New York City has a new plan for its schools, public, private, and charter. Some classes will now be outside this fall, but how will that work? NBC News correspondent Kristen Dahlgren joins me now. Kristen, tell us about this new learning program and where those outdoor classes will be.
Hey, Allison. Well, it's still all in the works, but we're talking about putting kids outdoors anywhere they really can. We've heard principals mention parks. We've heard them mention closing off streets, even maybe some outdoor dining places that aren't used during the day. It's really up to the principals. They have until Friday to come up with some type of plan. The mayor announced yesterday that he would be allowing schools to do this, and by this morning, they had already seen 243 applications from schools. We spoke with one assistant principal from Brooklyn, and here's how she described their plan.
We are hoping to close down the adjoining streets around our school, as well as hoping to use parts of Brooklyn Bridge Park as much as possible.
So the city also really pushing to get this outdoor learning into about 27 neighborhoods that were hardest hit by COVID-19. They are also going to be testing indoor classrooms as well for ventilation. They hope to have that done. They say they are going to be testing every single classroom in New York City, and they hope to have that done by next week. So all part of an evolving plan to get kids back to school safely, Allison.
Kristen, what are you hearing from parents about this one? How do they feel about this outdoor learning?
Well, the parents I've talked to are actually thrilled. They say they've been pushing for this for quite some time. They had some petitions with thousands of signatures on it. They really did want their kids in some type of outdoor environment. Of course, transmission is believed to be much less when you're outdoors. So here's what one parent had to say about how he was feeling about this.
It's about our kids and it's about their education, but it's really about the safety and the health of our entire city. So the ability for schools to have the space to learn is really the difference, perhaps, between life and death.
So I don't think anyone's really arguing with this medically being a good option. Here's what it comes down to, though. The complaint we're hearing is really the cost. And the city hasn't yet laid out exactly how this is going to be paid for. In some places, outside of New York City, we're seeing them actually erect shelters to put kids in. So it's unclear, how much are the tents going to cost and how are the schools going to pay for that? The complaint that comes with the economics of it is that the schools that can afford it, the communities that can afford it, the private schools, is going to increase the sort of inequality and divide we have between the haves and the have-nots, the kids that can afford to go to schools that can have these sort of wider open spaces, and the schools where maybe that's much more difficult to do. And so that's been the major complaint, is that this may increase that divide between kids that can afford it and who can't.
Kristen, I know it's not just New York school districts. We're seeing school districts across the country potentially moving their classes outside. What are you hearing from other schools across America?
Right, and we've been hearing from principals, this is such a unique time, and they've really had to dig deep and come up with some type of really ingenious thing to get kids back in-person learning, but also to try and have them socially distanced, try and have them outside if possible. So we have seen tents going up. We've seen these wood shelters being erected in places. There's a school here in Vermont where I am, where they're going to be using an outdoor amphitheater that was already in existence for concert and things like that. They're going to have kids outside learning so that they can space them out more. They've had things like benches that they can turn into desks in sort of a wilderness setting. Here in Vermont, it's going to get pretty cold pretty soon, and so they've also had to deal with plans for that, portable heaters, maybe heat mats, things like that. They really are trying to come up with solutions that can keep them in well-ventilated areas, because they think that's so important to keeping the schools open.
Well, Kristen, one thing is for sure, as long as the weather is good, the kids probably aren't going to complain about it. It must feel like a treat to be able to have school outside. I know when I was a kid, it always felt like one. So at least they'll probably be giving it rave reviews there. Kristen, it's great to see you. Thank you for being with us.
You bet. Thanks. Take care.
School nurses are feeling incredible pressure to keep students safe this year. CNBC special correspondent Jane Wells shows us just how difficult their jobs are during COVID-19.
Most schools in California like this one are not opening this fall, but many others across the country are. And you know who has the hardest job in America right now? The school nurse. There are nearly 100,000 of them in the U.S., but 1 in 4 schools in America doesn't have one. Districts have the huge task of figuring out how to keep students and staff safe, and the Nurses National Association is asking for over $200 billion to do that.
About 1 to 2 inches from the forehead, squeeze.
Like, imagine being CATHY GRANO. She is a veteran school nurse in New Jersey, training others on temperature checks. She's now having to decide all kinds of issues, like how many students can fit on one bus, how to isolate students with symptoms, use of restrooms, and contact tracing. But much of her job is educating parents.
Educating parents as to when they can and when they should not send the children to school, educating them on the hygiene practices, educating them on how contact tracing works. It's not just who they were with today, but it's who they were with 2 days ago.
Temperature checks may work at a smaller elementary school, but Lori Combe, head of the National Association of School Nurses, says that's not practical at large schools.
If you think about the high school I worked at with 3,600 students and screening the temperature every morning on 3,600 students, when is the time for instruction, right?
Meaning a lot of the time it's going to be up to parents to decide whether kids are healthy enough to go to school. Meantime, across the country, there is a huge push to at least let some special ed children back into the classroom because a lot of them are not able to learn via computer. And if they're not learning, districts are at risk of violating a federal law mandating a free and appropriate public education for every child in America. For CNBC Business News, I'm Jane Wells in Thousand Oaks, California.
Another college dealing with a coronavirus outbreak less than a week after the start of classes. The University of Alabama already reporting more than 500 COVID-19 cases, most of them on the university's main campus in Tuscaloosa. Dr. Anand Park joins me now. He is the chief medical advisor for the Bipartisan Policy Center. Dr. Park, as we see more and more outbreaks like this on college campuses, what concerns do you have about colleges and universities reopening and bringing the students back?
Allison, I think, I'm not surprised here, particularly when we're trying to open up colleges and universities where there's still a pretty high transmission rate, a high positivity rate, like in the state of Alabama. But I think, again, the most important key to success in terms of reopening universities and colleges are to ensure there's a low community transmission rate. Testing is also critical. Testing the students when they come on a campus. Regular testing is important as well. But beyond that, I think that the most important concern that I have is the adherence to evidence-based and public health guidelines and the enforcement of those. So we talk about masks and the use of masks in public settings. We talk about really banning large indoor gatherings on college campuses, restricting access to bars and indoor restaurants, perhaps in the community setting. All of these elements could potentially reduce the transmission rate as well as reduce the chance of an outbreak. And so I think at the end of the day, Allison, it's about shared responsibility. You need individual student responsibility. You need university responsibility. And then you need community official responsibility. And if there are any weak links amongst those three, you're going to see more and more outbreaks.
Dr. Park, it is really challenging to get thousands of 20-somethings together who may have been cooped up all summer or at home with their parents and say to them, all right, you can't be around your friends, you can't hang out with each other. What is your message and advice for college students who want to socialize and get out this fall while they're at school? Is there a way that they can still spend some time with their friends, that they can still socialize but be safe?
I think the message is that, yes, and social growth is very important, but it has to be done responsibly. It has to be done with masks. Physical distancing is critical. Gatherings preferably ought to be done outdoor in small groups. But it's really, really important. And I think this messaging, Allison, needs to start before students actually come onto campus. And conversations need to occur between parents, loved ones, before college-bound students go to the universities, and then they need to be repeated over time. So you can't start early enough. These are really, really important messages, and then it really needs to be enforced. So the message needs to be that if you're not adhering here, as we're seeing across the country now, universities and college campuses clamping down, suspending students, evicting students who are not abiding by these guidelines. So this is really serious. It's unprecedented, and I know it's not what a lot of college students thought that they would be entering or experiencing. But I think it's really important. It's a responsible thing to do.
A new report from the American Academy of Pediatrics says that 9% of the COVID cases in the U.S. are children, but it also says only a small number of them are hospitalized or die. What do we know so far about how the coronavirus affects children, and what does this study add to that knowledge?
Well, I think this study underscores that if you look at the totality of cases, hospitalizations, and deaths due to COVID-19, around the country, children make up a small percentage of that. However, it also shows that the number of cases of COVID-19 in children and kids are increasing. And I think particularly over the last few weeks with school reopenings, as well as there's more testing. Now, there needs to be more and more testing in kids. They're still disproportionately tested at a lesser amount compared to their population. So we need to continue testing in that population. But kids can obtain COVID-19. They can get quite sick. They can transmit COVID-19. So even though the numbers appear that children are least affected, they are still impacted. And I think that's a really important message for all of us.
Dr. Park, always wonderful to see you. Thanks for joining us again.
Thank you, Allison. Take care.
You too.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.